Hi, my name's Carrie. I'm going to be your nurse today. I'm going to be completing a physical assessment. I'm going to be going through the systems of your body from head to toe, and we're going to look for any deviations from normal, okay? So can you state your name for me?
I'm also Carrie McGrogan.
Okay.
Carrie McGrogan Livingstone.
Okay, and can you tell me where you are right now?
We're sitting in our living room and on the sofa, and you're going to be doing a physical assessment on me.
Okay, and can you tell me what the date is?
Today is June 30th,
Okay.
2016.
Yeah, good. The year. Okay, and also I'm going to ask you to remember 3 words, which I'll ask for at the end of this assessment, okay?
Okay.
So they are cat, phone, and book.
Okay.
You got those? Okay. The patient is a well-groomed, appropriately dressed for the season, and well-nourished patient. Okay, so first I'm going to be looking at your eyes, and here I want you to close both of your eyes for me. And right now I'm looking for symmetry. So both of her eyes are closed at the same amount, and she has no ptosis or drooping of the eyelid. Okay, you can open your eyes back up. Can you raise your eyebrows, please? And we have symmetrical movement, okay? Symmetrical movement of both of her eyebrows. And can I ask you to puff out your cheeks? Okay, good. So we have symmetrical puffing of the cheeks, and that is assessing cranial nerve 7, the facial nerve. Can you also smile for me? Here I'm also looking for symmetry, and she is symmetrical on both sides, and we are looking for function of cranial nerve 7, the facial nerve as well. Can you stick out your tongue? And here we're looking also for symmetry. She has equal symmetry on both sides, and this also assesses the same cranial nerve. Alright, so next I will be using both a soft and a sharp object to apply to 3 areas of your face. This is to test the trigeminal nerve. So you can close your eyes for me, and you tell me if it's soft or sharp. You ready?
Sure. Sure. Soft. 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 Sharp. 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 Soft. Soft. Sharp. Sharp.
Okay. Next we're going to be checking our extraocular eye movements, and this will test cranial nerves, the oculomotor, trochlear, and the abducen nerves, 3, 4, and 6.
Okay.
So I want you to keep your head still, and you're going to be following with your gaze this pen, okay? And now I'm just checking to make sure that her eyes follow where this pen is going. And this tests those cranial nerves. Okay, good. Next I'm going to be looking at the conjunctiva of your eyes, and that I'll just be pulling down your lower eyelid, okay? I'm just looking to see if it is pink and moist, and hers is. We wouldn't want any abnormal colors like blue or gray, and we wouldn't want it to be dry. Okay? And next I will be checking your pupillary response. So I need to get my light here. First I'm going to check for direct pupillary response. So I'm going to cover a portion of your face, and I'm going to be looking at how this pupil reacts to light, okay? And I'm looking for it to constrict. Good. Other eye. Good. And her pupils are equal, round, and reactive to light. Okay, so now we're checking for consensual pupillary motion. So that's to see if your opposite pupil will react the same way as the one I'm shining the light into. Okay, you ready? Okay.
Sorry. That's kind of weird.
I know. And her other pupil is reacting the same way. Next I'm going to be checking for accommodation. I want you to stare at this, and I'm going to move it close to your face, okay? Good, and now I want you to stare at this, and then stare at the wall behind me. Good. And I'm looking for how her pupils accommodate to the close and the far objects. Next I'm looking at your ears. I just want to make sure they're symmetrical on your face and that they are of the same size. I'm also going to take a look and inside your ear. Do you have any pain in your ears at all?
No.
No? No pain in this one?
No.
And she is free from redness and drainage or odor. Next, I'm going to be looking at your oral mucosa. This is just to make sure that it is pink and moist and the right color. You ready? So just open your mouth. And her mucosa is pink and moist. And now can you stick out your tongue, please? And I'm looking at her her palate at the top of her mouth, and that is also pink and moist. And can you say ah for me?
Ah.
Good. So her tonsils raised up. They are also pink and moist with no exudate. And by doing that, we are testing cranial nerves 9 and 10, which are the glossopharyngeal and the vagus nerves. Okay, and also I'm going to ask but not elicit the gag reflex. Do you have an intact gag
I do,
reflex?
without a doubt.
Okay, so next we're going to be looking at your neck and your shoulders. So I want you right now to shrug your shoulders against me. Good. So her shoulder shrugging is symmetrical, and do you feel any pain when you do that? Or
No.
No pain. And if there was not symmetrical movement, there may be damage to cranial nerve 11, which is the accessory nerve. Next, I'm going to be palpating your carotid artery. We do one side at a time because if we did this, it might cause a vasovagal response. So I'm going to just be feeling for that. And I feel her carotid artery. Good. And I'm also going to be listening for bruits. So bruit would sound like a swishing sound.
Mm-hmm.
I'm going to ask you to take a deep breath for me and hold it. And I hear no swishing, so no bruit. So now I'm just looking for jugular venous distension, and I see no distension here, and if she did have distension, that could indicate right-sided heart failure. Next, I want to look at the trachea, and to make sure it is midline, so I'm going to be feeling that. And it is midline. Again, a deviated trachea could be very indicative of a dangerous condition. And last is the thyroid. So I'm going to be palpating for your thyroid here. And normally you can't feel a thyroid unless it's enlarged, and I don't feel yours in both anterior and posterior positions. So now I'm going to be looking at your skin. I just want to make sure that it is all the same color. Do you have any lesions or new lesions that you know of?
No.
No. So her skin looks all around the same color. It's warm and dry. I'm going to do a test called skin turgor.
Mm-hmm.
So I'm going to pinch your skin, and it's very elastic, and it goes back to normal. If it was slow, that might indicate dehydration, and you're fine. And I'm going to be looking at your nails now. They should follow the natural curvature of the fingers. And do you have any tenderness in any of your nails here when I do this? No? And they are all pink, as they should be. I'm also going to be testing capillary refill, which is when I push on your nail, and your color should return within 3 seconds, which it does. Can I see your other hand here? And within 3 seconds. So good. Now moving on to respiratory, I'm just going to be looking at your breathing. And do you have any shortness of breath at all?
No.
Any labored breathing?
No.
Do you have any trouble going up a flight of stairs?
No.
No shortness of breath or anything?
Mm-mm.
Okay, so her breathing looks easy and non-labored. I'm also going to be looking for respiratory excursion. So here I'm going to be placing my hands on your back here, and I want you to take a deep breath in and out. Good. And whenever I do that, my hands move out at the same distance, so it is symmetrical. I'm also going to be palpating for tactile fremitus. So I want you to say 99 over and over as I move my hands down your back, okay? Go ahead.
99, 99, 99, 99.
Okay, good.
99.
You're good. And that is just a check for vibrations, which can be present with fluid in the lungs. So I'm going to be listening to your breath sounds. So I'm going to pick up my stethoscope here. And I'm going to listen on front and back, okay?
Mm-hmm.
So deep breaths in. And out. In. Okay. Okay. Okay, and can you turn around for me? I'm going to be listening down your back in a side-to-side motion. Deep breaths. You can breathe like normal.
I might breathe slower normally. Why do doctors always do that? They're like, breathe in, breathe out. And I'm like,
Okay.
I think we're ventilating.
And I can hear medium-pitched breaths over her major airways, which are the bronchioles. Good. And observing the chest for any thrills, I don't see any. Okay, so the first thing I'm going to be doing here is looking for the point of maximal impulse, which is the best place to hear your heart sounds. We want to go mid-clavicular and then down to the 4th to 5th intercostal space. Okay. I'm going to listen here. Okay. I'm also going to be listening for the aortic, which is in the 2nd right intercostal space.
Mm-hmm.
Okay. And I'm going to be listening in the left 2nd intercostal space for the pulmonic valve. Okay. Tricuspid, which is in the 4th intercostal space in the left sternal border. So that's going to be like here. And the mitral, which is in the 5th intercostal mid-clavicular space again. So, and usually we can hear the heart the loudest at the apex or the bottom of the heart.
Mm-hmm.
The bell can be used for low frequency sounds and also for listening for murmurs. And do you have any type of murmur?
I have a benign murmur from childhood.
Childhood.
From childhood, yes.
Okay. And I'm also going to be listening to some of your pulses. So I'm going to listen to the radial pulse, or palpate the radial pulse, which is right here. And actually, can I feel your other side?
Carrie.
No, that's okay.
It's a long day.
And they are symmetrical, +2. I'm going to be listening for your brachial, palpating for your brachial. So if you go like this. +2 for that one. I'm going to be looking at also your pedal pulse, which is on your foot. It's on the top of your foot. If we can make that in view here. It's going to be right here. And I can feel that.
Pulses.
Yep.
Pedal pulses.
+2.
Do the other one too. Just check.
You can find it like if you move your hands down between these two bones.
Yeah.
Yep. And you have them. And then also posterior tibial, which is. Yep.
Groove.
And +2 for that one as well. Good. So now we're moving on to your abdomen and gastrointestinal system. First, I want to just inspect and feel the skin. It is warm and dry and smooth contour here. I don't see any pulsations or peristalsis here. Peristalsis could indicate an intestinal obstruction. I'm going to listen to your bowel sounds as well. So
this will be interesting since I just ate.
Yes. So we like to move from the right lower quadrant and go counterclockwise because that follows the large intestine. And we listen for 2 minutes in each quadrant before saying no bowel sounds. And I hear yours, so we can move on right away. Good. And they just sound like a low gurgling voice. Good. Okay, so now I'm going to be listening for the abdominal aorta. I'm going to just check right in the middle here. We also check for bruits in these major arteries. And the renal arteries. We also listen for bruits. And the iliac arteries. Same thing, just listening for bruits, and I don't hear any. And I'm also going to palpate your abdomen. So Here, I'm going to just move in the same pattern. I would be feeling for any kind of masses or any organ enlargement, like an enlarged liver, enlarged spleen, and I do not feel it. I'm also going to listen to the femoral artery, so
Good.
you found your pulse here. I'll listen there.
Can you hear it?
No bruise either. So now we're moving on to the lower legs. First, I'm just going to inspect for even hair distribution, and I will look for any shininess, any ulcers. You don't have any lesions, and you have shaved legs, but I can feel that hair distribution is on both legs. Skin is warm and dry. There's no coolness, which could indicate a peripheral vascular disease here. You also do not have any edema here that I can see. You can do squeezing and check for pitting edema. And you have none around your ankles, feet, or on any of your areas of your legs. And the next thing I'm going to be doing is looking for strength of your lower feet. So you can straighten out your legs here.
Yeah.
Okay. And I want you to push against my feet. Okay, and she's very strong here. And then opposite way. Good. So your strength is perfect in your feet.
Plantar and dorsiflexion.
I'm also going to be checking for the Babinski reflex, which is normally found in children under 2, and it's normal there.
Right.
But in adults, it could indicate damage in your brain. So, no, you're not supposed to do anything.
You should leave that there for her.
I know. Now I'm going to be testing for Babinski reflex, which is normal in children under 2, but abnormal in the adult. So I'm just going to run this pen up against the side of your foot, and there's no flaring of the toes, so that is a negative Babinski, which is what we expect for an adult. So now I'm looking at the curvature of the spine here. The cervical and thoracic parts of the spine are concave, and the thoracic and the sacral parts are convex, which yours are, which is good. Your posture is erect and it is symmetrical. You're standing with an erect posture. I do not see any kyphosis, scoliosis, or lordosis. Okay, so now can you walk towards me here? I'm just checking for your balance and your gait. It should be easy for you to move and not tentative. You should flow easily with rhythmic movements, and you do. Next, I want you to do heel-to-toe walking for me. So that's just putting your foot right in front. And this is just a check for cerebellar disorder. And you are good. And the next test I'm going to be doing is the Romberg test. So I want you to stand straight here. And I want you to close your eyes and put your arms out to the side. And it should be straight with no swaying or movement, and you're good. So next we're going to be checking for finger and thumb opposition. So what I want you to do is, you can watch me first, you're going to move your thumb and you're going to touch each finger and then back again. Good. And that is also another test that can indicate, if you can't do that, cerebellar disorder. So next I'm going to have you put your arms out to the side and close your eyes, and I want you to touch your finger to your nose. Good. Other one. Good. Okay, and next thing I'm going to have you do is I want you to put the heel of your foot on the shin of the opposite leg. Good. And the other side. And that's also checking for balance, and you're able to do that. So next I'm going to be checking for the range of motion in your joints, and since you're able to actively move, you can show me your range of motion here in your joints. So wrist, your elbow joints, arms. You can do your rolls, put your arms all the way around like this. Good. Okay, so now for your,
Externally rotate.
Abduct, adduct.
Mm-hmm.
Good. Your knee joints. So can you bend your legs at your knees?
Abduction and adduction.
Good. Okay. Other one. Okay. And your ankle, which I can see.
Just tip it down.
Okay. Other ankle. Okay. So next I'm going to be checking for your patellar reflex, which we will be hitting right here.
Yeah.
Okay. So
Wrist action.
ready?
Mm-hmm.
And I saw a movement of your foot.
Oh.
Good. Okay, and the other one. So here we want to make sure that the patient's leg is dangling We're going to go right here. Good. Okay. And I saw a response with both of those. And for your last question, can you give me those 3 words that I gave you at the beginning of the assessment?
Cat, phone, and book.
Good. Okay. So her memory
I got scared there for a second.
is good and intact. And that is the conclusion of the assessment. Do you have any questions for me at all?
Am I normal?
Yes, you're normal. Okay. Thank you.
You're welcome.